I'm Jennifer Hunter, and around about 10 years ago I was working as a professional model. I was driving round a ring road and a lorry sideswiped my car, which tore the muscles in my lower back, which meant me missing out on London Fashion Week and Milan Fashion Week, and if you're a professional model, they're pretty big things to miss out on. So after time, when you try and go back to work as modelling and you can't walk straight and you can't hold your figure straight, you realise that the problem hasn't resolved itself and there are still some underlying issues. You carry on, but the issues arise when you try and drive your car or pick your child up and the pain becomes unbearable. As a result of tearing the muscles in my lower back, I went to see a range of therapists and specialists, from chiropractors, acupuncturists, sports therapists, which would solve the problem for a couple of days, but then the pain would come back, and it would come back stronger and harder because I'd been working my back more, thinking the problem had been resolved, which it hadn't. After going through a range of what I thought were specialists, I couldn't pick up my daughter. I was finding it hard to drive because I couldn't fully turn my head and my neck left or right. I was struggling to stand upright and have my shoulders back. I was in so much pain that it changed my everyday life. So I remember my first treatment lying down and Amar working on my shoulders and neck, and then looking at my full back and telling me that my back was actually twisted. He worked all the way down my back to find out that the original problem had started from the accident I'd had 10 years ago, not being treated correctly, which was twisting my muscles and pulling on the other muscles. Combining that with being in an office environment, sat down, hunched over at a computer for the length of time I was, it had all interlinked into one, and I'd never had that explained to me before. As a result of the first treatment, I could move my head from side to side fully, I could move my shoulders back, I could sit upright, I could lift my arms up above shoulder height, I could pick my own daughter up for the first time in a long time. So I would like to thank Omar for being a pain specialist, using his unique COPA therapy treatment on me and improving my life for the foreseeable future.
So seeing Jennifer after 6 months now, I could see that the muscles become a little bit tight again, and that is just due to daily activities, which is the lactic acid swells up every single day. I have to say that she's been a very good girl. She's looking after her posture and looking after her stretches. Otherwise, the pain or the lactic acid would have built up a lot more than that. Can you just turn your head into the right, into the left? We could see that she's got a full range of movements. When you turn your head into the right, any pain at all?
No.
Okay, to the left. So Jennifer doing the sensible thing, she's coming to see me even though she doesn't have actually any pain, because what I explained to her a few months ago, that the actual lactic acid builds up every single day. There's nothing she can do about it. So I'm going to have a look at now at shoulder level. So looking at Jenny now, while she's standing up, that her right shoulder is lower than the left shoulder very slightly, where it used to be much lower. And that is due to the trapezius muscles, which runs into half of the tattoo or half of your back. What should we call it?
Tattoo.
Tattoo. Alright, half of the tattoo. So it runs from there to there to there. So when this muscle is tight, it's shortened. When it's shortened, it pulls down. And I'm pretty much sure also because of her lower back as well, because that actually will tilt her pelvis. So she will have a tilted pelvis. But let's just talk about her upper back now. So this is why she's got that lower shoulder. So what we're going to do is we're going to lengthen these muscles and remove all the lactic acids, and we just take it from there. So examine her upper back now and lower back. That justifies why she still have a slight differences in her shoulder height. which is we've seen before. So she still have the trapezius tightness muscle, but again, there's nowhere near how it used to be. Okay, so we're gonna work on these muscles, and I'm gonna show you the stretches. From other videos you have seen what I actually do, so today I'm actually gonna just show you one stretch which is I use when it comes to a lower back. So now we're gonna do one just a stretch on Jenny for her lower back and the glutes, and that's very effective. So what we're gonna do is we're gonna cross the leg. Okay, we're gonna have the leg this way. Okay, now in extreme cases you can't really do this because the patients will be in a lot of pain. Then I will push like that. How are you feeling?
Yeah, that can be
Okay, is it stretching?
Yep, it's really.
Are you sure?
Yes, it's really sure.
Okay, so now we go down and we count to 30, and it depends how nice you want to be to the patient. Okay, so I could push a little bit more, but now because she's got a little bit of a tightness, so we'll leave it up to there. But what I will do is I will repeat that a few times to make sure that stretch is actually happening on the glutes and actually on the lower back as well.